back and sitting here very luckily with Ginger Katz and Dr. Skip Sviokla.
Yes.
Pretty good?
Yeah, very good. Dr. Skip was perfect.
Dr. Skip was perfect. And we were so thankful we had a nice discussion with each of them about their particular reason for joining us and wanting to stop what's happening in this world right now with the drug addiction and the kids and the adults and everybody with all the opiates and the alcohol and every reason out there. But there were some things that we really wanted to address and add, and I'm going to start with you, Ginger. One of the things that you had talked about, and also what is on all of our minds, we see the signs. If we are lucky enough to spot them, because we know how great hiders they are of them, but if we're lucky to see these signs, what are parents doing? Do they want to see them?
Not necessarily. They would rather think that their children are not using drugs. And I tried to figure it out over the years and why they retreat, why they don't act right away. It's because they kind of blame themselves. They think they're bad parents if their child is using drugs. And I tell parents, give that thought 2 to 3 more seconds and let it go. This is a $400 billion industry, and dealers are targeting our children, and most parents are not equipped for that. So let it go, because if you stifle yourself from helping your child, the addiction can escalate, and then you're dealing with a full-blown addiction.
And then you're kind of going into your own shame and your own... which is unproductive.
And also get help for yourself, because you're dealing with the fact that your child made an unhealthy decision. You shouldn't be ashamed of your child. It's a brain disease. It is now noted as a disease. And the child needs help. And an assessment is required, and it's a question of health now. It's not a question of shame.
No, it's a paradigm shift. So you have to have people recognize that.
I bet you can speak about the feeling of what she's talking about.
I can, and I don't treat teenagers. My lower limit is 18. I see a lot of teenagers coming into 18 and above into my practice. I certainly have read a lot about it, but there is no question that when parents accompany the child and they've gotten that far, there are many facets they portray. One of them is denial. There's no question about it. They're there. They don't want to be there necessarily. There is a lot of blame going on, although it's always quiet. Everybody's supposed to be neat and clean. And I really want to talk to the child alone first, because I'll never get the truth. Because later I want to see what the dynamic is, because 18 is still pretty infantile when someone's using, so I agree with you. It is a medical illness. There's no question about the fact. I'm a little concerned that that's getting so much good press, that it's a medical illness, not a behavioral one or a moral failing. I do agree with that. But in my case, and I'll speak for myself only, I made lots of bad decisions before the disease grabbed a hold of me biochemically and turned me into a zombie trying to get more in withdrawal and addiction. So it is a brain disease, but we earn some of the stigma that we get if you get into it, as long as I have been in it and as long as I was using. So I do think that we need to establish trust, and the only way we can do that is by admitting what we're doing. And it's so hard on the parents because they don't know which way to go on it. You know, is it my fault? Is it his fault? But the longer you don't seek help, the more anger you get toward the child, because you're being manipulated. That's the nature of the illness. That's not necessarily your child doing it. It's, what do I do, as you say, to keep on getting what I want to get? And I think it's a real problem.
Accountability.
The stigma of addiction is really, I think it's about time that we addressed it. But I was in a meeting of the Governor's Overdose Prevention Council in Rhode Island the other day, and they had all of the big primary care providers there. And when the topic of the stigma of addiction came up, it was for doctors who were getting these special licenses to prescribe a drug called Suboxone. What they heard when they heard stigma was, my office is going to be stigmatized as having a bunch of addicts in the waiting room. And I was shocked. I said, what? That's not what we mean by stigma of addiction. They said, well, no, we understand you're addicted. But doctors who are used to handling patients that aren't addicts have a really new way to cope with addicts who don't tell them the truth anymore. So they have a subset of patients trying to treat addiction when they have certain of these licenses. So stigma is a word which needs to be looked at carefully and addressed front
So communication is really to keep the lines of communication open as much as you can. And going back to your Courage to Speak Foundation, that starting like teaching these kids at a very early age in the elementary school about it's okay to speak out if you're afraid of something or you've been bullied or there's some kind of peer pressure, and maybe hopefully give them the coping skills to move on.
Exactly right. That's exactly right.
That kind of reminds me of something in that you wrote about in your book. Your dad was always interested in you're going to feel this way kind of thing, as opposed to how your feelings were not really... Yeah, not that we're blaming Dad.
No,
poor Dad.
I'm not. No, he did a lot of good things. He paid for medical school extra.
Plus one.
Yeah. It took me a while to tell him because we had to pay for another whole year.
Sure.
Yeah, there's no question about it. One thing, and it's true. He didn't care about feelings. He cared about results, and so we never had any frank discussions. And I am not blaming him. He did. I just wish that they had approached it a little differently, but that's in hindsight. The one thing that I found remarkable when I sat there, I had to strain to hear you because I was behind the lights over there, but have you always been able to talk when you wanted to talk as quietly and as calmly as you're doing now? Because the demeanor with which you approach this is so important. The anger and sparks that fly when I do finally have parents come in with the older kids, it's remarkable. It doesn't take very long for the tone to change completely. One false word, and your demeanor is terrific.
I've done a lot of work.
I'm sure you have.
20
I've done
years.
a lot of work.
Yeah.
Even longer than that. I've done, and I have a deep understanding of the disease of addiction. And like Al-Anon says, I didn't cause it, I couldn't cure it, I couldn't control it.
Right.
I had to give it up. It was a power bigger than myself. Parents don't want their children to make mistakes. They don't want them to choose to use drugs. Kids don't choose. I think they're pushed into it, or they act. Within a second, they take a left turn or a right turn. And sometimes taking that left turn could affect them the rest of their life. And they do it because their brains are not completely developed until they're 25. You were talking about that before. And parents really have to understand that. You could tell a teenager, now when you pull out of the driveway, I don't want you to go fast. Sometimes I've heard you screeching out and, okay, Mom, I heard you. They get in the car and boom.
Right.
It's not always defiance. It's that the brain is not
completely... They don't hear.
They don't hear it.
Teenager, yeah.
So as far as drug prevention education, they have to get this over and over and over again, but in different ways. There's a lot of ways to teach, to have the conversation. It's not just don't do drugs. It's about having a conversation and about friends who use and finding out about their friends, finding out about their feelings and why. The main thing here is, why do children want to use drugs? Not so much about the drug they use, it's why do they want to change their behavior? Why do they want to change their feelings?
What are they not comfortable with inside?
Exactly.
But what you were saying, both of you before, is let's find out why after.
You have to stop, or else you won't be able to make a lot of sense out of anybody who's actually using, because their skills of controlling you or trying to manipulate the situation are heightened in their own mind, so they're going to try to maximize their ability to delay the inevitable, which is not stopping, which they don't want to do. It's a fast-developing disease, but it's slow to heal. And people are always in a hurry. Okay, now, you haven't used it in a week. It's all set. We're all going to go. We're going to fix everything. We'll go to Disneyland. We're going to do everything we can. And it just doesn't get well that fast.
And that goes back to your point as well.
But you need
I'm talking about the younger child
Yes.
in the beginning when they're first thinking about using alcohol and marijuana. Find out why. And why don't they feel good about themselves?
Well, and earlier, Pauline was saying that there's a part of the kid that just wants to have fun. There is that pain as well for some of the kids that push them into or a stress or a stressful situation or APs or whatever it is. But there is also that kind of
they see it. They see it around them.
And then we have
they mimic the behavior.
We had the story of you where the grades were falling off and some of the signs were that, but we have a completely different story with
This
you.
is a many-headed beast. It comes at you a lot of different ways. Absolutely true.
I mean, you were a success. You were coming from a success story.
I was.
Everything was good.
I was a fortunate guy. I was given a lot of gifts, and I eventually threw them all away with both hands, no question about it. So each of us gets to the disease in a different way. But I'll tell you one thing: we can all enjoy our recovery once we stop. But we have to stop. I know that sounds silly, but anything that tries to moderate the stopping and not stop it, I think is delaying the cure of the disease. And I know that word's very emotionally
Explain
filled.
to me what you mean by that.
People think, a lot of people in the 12-step program say you're never cured. You're always one drink away from drinking again, which I believe is true. So I shouldn't use the word cure because it's not necessary. Mm-hmm. In order to be free of the daily craving, you just need to stop for a little while before it actually sets home for most people. So you're not cured. Look, I could leave here, I guess, and go have a drink. I don't think I will, as we talked about before. But you must stop. You must let your brain heal, because your brain starts to get all these connections and these neurotransmitters change, and you're not really thinking, either when you're impaired or when you're going into withdrawal. Even if it's mini, you're not thinking clearly. So you can't make sense to your kid once he starts using it, I don't think, until they've stopped. You've got to get them in that environment. There are lots of other ways to feel good. But even that can get you in trouble. If you're the captain of the team and you just won a big thing and you're enjoying that, you got to be a little careful about that, because that can, as we talked before, prime the pump for, I like that feeling good. So it's a tough issue.
That really brings me to ask that, you said we have to be aware of what type of person we are, right? And how we experience each, you were saying Ian is somebody who, went at things and, went at them big, right?
Oh,
he
yeah.
was
He
very
would
successful young
ski
man.
at the top of the mountain.
Right.
His friend said, "You don't want to ski with Ian. You don't want to skateboard with Ian." He was a risk taker.
He was.
So then he'll go to a party and there'll be a bowl of pills and, he's a risk taker.
So knowing
they
how to-
don't know what those pills are and they'll take them.
Right. And then one of the things, though, that we're saying is get them in, help it. And then but all we hear about is that we've got them in the help now, and then they go back to that same dose, which is...
In withdrawal, you're right. They're at risk when they go detox from a dose of the opiates they've been using. There's no question about that. They built up a tolerance, so that it takes them 3 grams of heroin to get high instead of 1 gram. That might have taken a year to get to. But if you're in detox for a couple of weeks and you go out and you think you need to use 3 grams to get where you were, should you be relapsing, 3 grams will kill you at that point when it wouldn't have a month before. So that's where a lot of these people die when they come out of rehab.
Do you think Ian knew that part of it? You don't think he learned that part of it? So we're doing better in the education part of it. We're just... That's got to get out there.
And the mixing of drugs. People are mixing the alcohol with drugs, or 2 different types of medication, 3 different types.
Big problem.
People, children don't. There was a trace of Valium in Ian's toxicology report, and it was heroin and a trace of Valium. So that's lethal.
And
even a trace.
And you also said what the doctor said. So you not only had your husband didn't tell you right away, or your ex-husband didn't tell you right away.
Kept a secret.
We had some of that. We had some of the friends not coming and telling you about, and then you said the last part was that even the doctors, after he had died, what they said to you?
Tell people that he died of an aneurysm or a heart attack.
That's horrible, but that does still happen.
It does still happen.
It still happens now.
Yeah, not by any good doctor, but by doctors who ought to know better what to do now.
Or parents, I'm sorry, but parents don't want to say.
No, of course not.
And that's okay. There are no wrong or rights how you handle a death.
For yourself.
Unless you're hurting someone or somebody else. Right. And if they don't want to divulge how their child dies, I don't blame that parent. It's devastating, and that's their choice, and it's okay.
Certainly we're getting an
but I
incredible
couldn't
benefit,
do that.
Right?
I could not do that. I couldn't, for 1 minute, bury him with a lie. That I wasn't ashamed of him.
And
he was a good kid.
This is where the stigma.
He made an unhealthy decision.
As you said,
that's the main point.
It's not a stigma.
That decision, yeah.
That's correct.
It's so hard.
And a lot of people do try to cover up. I mean, read the obituaries. You'll see they died and they never mention anything. And you If you don't want to shout from the rooftop what's happened, that's fine. If you want to, that's fine, and you're doing a lot of good by doing that. One of the things I find in all the press that's coming out, especially about Narcan, a drug which is supposed to reverse opioid overdose, and everybody's all excited about giving everybody Narcan. That hasn't been reasonably well thought out in my view. What happens is, and I know I treat opiate addicts every day, Narcan will save your life for 45 minutes and may get you to a hospital in time to be brought back, but it's treatment beyond that that's needed. Now, when you read about Narcan, everybody starts thinking, great, we'll get Narcan around, and if my kid overdoses, we're going to give him a shot. Here's what happens when normal people that aren't addicted, the 90% of people who aren't addicted are family members, they will say, if they've got a using child or a using spouse, see, look at that, they almost died, and they got, well, people who are using don't look at it that way. They just think, that'll never happen to me, I'm not going to do that. They're not going to argue about it. When they see statistics of the new fentanyl-laced heroin, which is killing people left and right all around the country, everybody who's not an addict goes, see, you better be careful going out there. You might get some of that fentanyl. The active child or the spouse is going, in the back of their mind, I'd like to get a hold of some of that stuff. When we're actively using, we don't look at things the way everybody else does. So the same press that's going out helping doctors who aren't addicted slow down their prescribing practices, like you learned from me and from their orthopedic surgeon, that's great news. But addicts are, even people I had in treatment would come in and say, to be honest, I wouldn't mind trying some of that fentanyl-laced heroin. Sounds really great. And I'm glad they were honest enough to tell me. And I said, that's going to kill you. So all the news comes out are received by two audiences. The active user does not hear it and go, whoa, I'm going to stop now. They don't think that. They think, I'll be careful.
So how do we change?
Well, no, I think more people are helped by it, but do not think. There's a recent death of a patient in Rhode Island who kept signing out of the emergency room after he got Narcan. He signed out 7 times in a 2-month period. Everybody was furious because when he woke up from his Narcan, he didn't want to stay. Well, when you wake up from an injection of Narcan, the last thing you want to hear about is recovery. All you want to do is go use, because the Narcan has put you into acute withdrawal. That which took me 72 hours to get when I couldn't get any more Vicodin, you get in a minute.
Instantly.
You wake up and you're going, oh boy, you're lucky, you almost died. Okay, all right, what do I have to sign? I'm getting the hell out of here. That's what they think. Happens all the time. So how do you capture that person? Can you keep them against their will? Because if they're adults and they're over 18, they have a right to leave. And you can't report them unless there's a hold where you're going to keep them around for their own good. But people, so there's a lot of knowledge yet to be disseminated so that people do not make the mistake of thinking the more Narcan we send out, the safer people are going to be. How about the Narcan that people are saying, this is good. I'm going to keep this right in this drawer, and if I do a little extra heroin and I'm feeling really good, I'm going to go use that to reverse it? It's insane. Okay, so the news has to be filtered through intelligent understanding of the mechanism of the drugs.
So we have to get them from both angles. We're going to get them when they're young. Mm-hmm. We're going to educate them, and then we're going to keep them out of trouble.
Right, and we're going to say what works, and what works definitely is in treatment, talking to people, and the honesty that is needed. That is the first casualty of addiction in my mind has to be restored, and finally does when people stop using and realizing they're not going to get anywhere with their lives anymore. I think that's critical.
That they're not going to get any more
anything with their lives. Their lives is not going to do anything except
keep the awful
life they're on. By the way, most people who are abusing opiates, they're not having any fun for a long, long, long time. Mm-hmm. Everybody thinks, wow, they're having fun, they're getting high. They're not getting high, they're just trying not to get sick.
Mm-hmm. To maintain
that's,
to be even like us.
Yeah. Do not let me go through that withdrawal. I might get a little buzz for a couple of minutes. The idea of getting the heroin, if they're that close, is almost as comforting to them as getting it, because they're not feeling the first euphoria they feel the first week, 2 weeks that they're
always chasing that.
They're always chasing it, and they will all tell you, if you get them to tell you honestly, which they do after a while, it was miserable every day, and yet they kill people, hurt their families, do everything just not to be sick. It's no fun after the first couple of weeks, believe me.
There's one more thing. If we can just, the lies. It's very, very hard for a parent, as you know, and it's very hard, you tell them, right? We hear them. It's hard to know what are the lies, what are the truth. Any suggestions. You said in your book, I hear them. I know now when you were in AA, people were listening to them. You heard them from Ian?
When parents call me and they say, my child is just smoking marijuana, well, that's big in itself. But I said, well, how do you know he's smoking just marijuana? Because he told me. I said, did you get an assessment? No. What's that? Or how do I get that? A parent wants to believe that it's a gateway drug only. So what the child needs is an assessment, because you really can't believe anything somebody's telling you who is on their way to being a full-blown addict or an addict themselves. You cannot believe anything they say. So you want to, parents want to, but most of the time
it's easier, I guess.
It's easier. It alleviates their pain. These parents are in so much pain, and they're so anxious because they think their child will die. They need help too, and remember that. It's a family disease. The person that's addicted doesn't only carry the burden, the entire family carries it, so they all need help in many different ways. Mm-hmm. And help is out there. Help is out there.
And the assessments that you talk about, that's like in the doctor's office or in a clinic, or?
There are places. I have on my website where to get assessments. I have a laundry list of those. And any good rehabilitation center will do it.
Is that the first thing you do? I was just going to say.
Absolutely. You take the whole history and you listen to it. And I start treating them with most of them with the medication. And when they come back, I'll listen to the stories. And I don't believe a word they say. I tell them, listen, that sounds good. Let's see what your urine shows this week. Because they will lie and lie and lie until they finally get that they can't fool you anymore. Mm-hmm. And I'll tell you, there's kind of look, all addicts usually lie. Not everyone, but damn near everyone. What happens is, an alcoholic lies. It's a stupid lie. Have you been drinking when you smell bad, you look bad, and you start? Absolutely not. An opiate addict who can speak clearly, and as long as he's not taking benzos or drinking, he can make a lot of sense. He'll tell you the most elaborate story, and you'll even start to believe it. You go, well, I don't think that happened, but it could have. And they really talk themselves into this situation which even though I, the addict, know it's not true, you should believe that. That's a believable story. Because, you see, I dropped the pills down the toilet, and then the toilet's... But I sit there and watch them, and they're going through this terrible... That's because they don't want me to throw them out of treatment or refer them back into inpatient treatment, because they're telling such a whopper. They get furious if you don't believe the lie. And they really, by the end of the time, they're elaborating on every detail. They're believing it, or they're thinking, I should at least believe it, because it is, after all, possible. I go, yeah, it's possible, but you're lying. You have to do that until they begin to... Their actions speak a lot louder than their words, and that absolutely works in addiction, just like it does everywhere
And so
else.
does the urine test.
Yeah. Mm-hmm.
So, an assessment.
Urine test.
Yeah.
Urine and blood
from
test.
A doctor.
Yep.
Hair test.
Urine test. And they have to keep up with the times, because a lot of the things you get in CVS are missing. Like fentanyl doesn't show up on an opiate test.
Right.
So the most deadly drug out there now will not show up positive for an opiate if you buy a $50 or $100 test in CVS. You dip it, and it'll say negative, even though your son's falling down, and it's because he's using fentanyl, which isn't picked up by the test. So you've got to stay ahead of the technology, too.
Fentanyl is as rapidly used as heroin
50
right
times
now?
the amount of heroin.
Yeah.
50 times.
That's correct.
50 times the amount.
Right, and they're making it cheaply in Mexico, and what they're doing is they're sending a lot in here. Some's coming down from... It's 50, and there's a new drug called W9, synthesized by some Canadians, which is even 100 times more powerful than fentanyl. It never was used for medical stuff, but it's there, it's out there. So these are going to be missed. When people are obviously impaired, you've got to make sure you get the drug test doing it. You've got to keep them safe, because the technology of the people selling all this junk is way ahead of the technology. Keep up with it.
Okay, and I really can't thank you enough for coming on. Stan and I are so grateful. The key, I just want to stress again what you said. It's a cigarette, marijuana, that every 98%, 99% of the patients that you see started with marijuana. So we're saying...
And every parent who has lost a child that has called me over the years, and that's been a lot since 20 years, and whose children are using, I always ask that question once I get to speak to them at a time. what did your child start with? And marijuana seems to be, and alcohol, but marijuana seems to be the culprit. Marijuana wreaked havoc on our family, and it does on families.
Yep.
And it's breaking down the families, and I can't speak any more about this. And we have to keep, it's about safety and health now. We have to keep our children safe. So, and I know it's been difficult because there's been mixed messages in our society right now, but we have to think of the children. They come first.
Well, your message is good and loud and clear, so thank you very much, both of you.
Thank you.
Beautiful. Thank you very much for what
you.
you've done for everybody and what you'll do for those to get to see you.
Thank you.
Thanks.
Okay, thank you. Thank you.